Hello YouTubers, this is going to be a video on Tplo surgeries on the knee. It's basically the ACL, a half tear ACL. Okay, I'm just going to give all the information that I can as fast as I can, and hopefully this will help you out with your dog or your surgery decisions. This is Maggie. She's a 5-year-old German Shepherd. She's a mix, of course. She has hip dysplasia in the left hip, and we're not going to do anything about that right now. But she had basically a half-torn ACL on the right side, so we had to do the procedure for her to walk properly. Beforehand, her liver enzymes were high, so we had to do the procedure before the surgery to make sure her liver would take it. That's why she's all shaped there. But this is all off my cell phone, so I hope this helps you guys out. But basically, here's the leg. We're 6 days after the Tplo surgery with the plate put in. It's still quite swollen. Doctor said 6 more days from here, and we will have. I know the light's pretty bad. Let's see if I can turn this light down. See if I can do something about this light real quick. Pretty much the doctor said that the swelling was going to be normal for the leg, and not to worry about it. 6 days after the procedure, that's normal. So basically, let's see if she'll let me get in here. Can I see your leg, sweetheart? Can you show everybody your leg? Come on. Come on, sweetheart. So, it's still quite swollen. There's a little bit of a bruising down there on that side, on the bottom. Of course, there's one more little suture that goes on the bottom there. But, you know, for the most part, you know, there's a little bit of gauze. She had the wrap on for 6 days. We had to wrap on for a week. And, you know, a little bit of it got stuck on the staples. So, a little bit of swelling right here, and a lot of swelling down in here. It's real red, and so the doctor said she's doing really good. She's bearing weight on it. She's walking on her own. Which is okay, you know, I assist her, and I do everything like that. But basically, she's taking Tplo for pain, and she's on Keflex for, you know, for infections. And let me get this up here. I use that to kind of help her leg out. And what else? She's on a whole bunch of other things, but basically that's what I'm going to tell you. She's on for pain, Tplo, and she was on Remedil, but not for the liver anymore. She's on some liver medicines, but that's what we're fighting with her. She's got hip dysplasia on the left side. That's the procedure. So, like I said, 5-year-old German Shepherd. Make her comfortable. I got a nice orthopedic bed. I paid big bucks for this bed. I'm not going to plug the name brand out there, but if you do your research, I'm sure you'll find all kinds of them out there. I needed one for my size of a German Shepherd. This is all space foam, and you know, for dogs that have hip dysplasia and recovery patients like that. So, you know, I spent a little more money for that. That's how we were able to keep this animal down for a long period of time without her getting up and rotating, etc., etc. So, I just gave her a pain medicine. That's why she's a little twitchy. But the first couple days after the procedure, I did buy this dog gate. I got it at Petco or PetSmart. I can't remember. It was on sale for $42. It's really cheap. It's, you know, it's not really cheap, but it's really nice. It's cheap. It was $40. I have it up here against the kitchen wall here. As you can see, there's my kitchen, and there's an island here by the front door. Easy access. I can just move the whole thing by hand, and you can snap them together, just, you know, with your hands. Real easy to work and assemble. There's as many pieces as you want. I mean, that's a pretty good square foot right there. That's probably, you know, 10 feet long by, give or take, 5 or 6 feet wide, and I still have an extra piece of gate behind my couch here. So, I mean, it holds a pretty good area. That's where I keep the orthopedic bed, is up there, and she sleeps in there at night, and my bed of course is over there, and this is what me and my wife have been doing. I don't want my animal getting up with the plate in the leg and et cetera, et cetera. So when recovery, she's doing great, but I just want to keep her off of it as much as I can. But anyways, that's what we bought. Some other things here I want to plug away real quick. Basically what she's eating is, I got her on a special food, but whatever, for the bone, since they cut through the bone here, I got her a cup of food. I give her 4 cups of food a day, and I usually add good 3 or 4 good tablespoons of cottage cheese in with the food, and that's again just a good daily dose of milk there that will start to regrow the bone where the plate is and the screws and everything. That will really a good dose of you can give your dog vitamin D milk if you want. Anything that a good milk intake is great for the leg structure to grow back stronger. Here's some things that I bought through the surgery, things I give my animals. I bought her a lift aid, Petco again, $35 I think roughly. Petco or PetSmart, it really did help her through the recovery. The lifting aid goes around their front end, and it basically holds them, mobilities them, so you can walk around with them. There it is. It works great for us. Here's some medication that I give my animals. Fish oil, of course, with everything is always good. It's omega-3. It's a gel caplet. Great for the. Let me see if I can zoom in here. Great for the skin. It's great for it's anti-inflammatory. It's good for the joints. It's good for everything. So do your research. Don't give anything you don't think you should give to your animal. But of course, fish oil is pretty common. Veterinarians give it a lot out, and they recommend it too. So anywho, that's something I give. And here's another stuff. We have hip dysplasia in the left hip for Maggie, and this is some pretty good stuff we've been finding. Again, this is veterinarian recommended stuff here, so this is not anything I just don't give my pets. This is stuff that they sell at Petco, PetSmart. This is about $35-40 for what you're getting here. This is a hip joint medicine. It's a conjointant plus MSM, and basically that's the MSM is the it's a pain reliever, basically over-the-counter pain reliever for dogs in this pill. So you get without having to spend the big bucks for the $400 a month for the shots in the hip and blah 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 blah. I don't want to bore you with it, but you get the point. You can give them these pills or chewies. It's got a high dose of glucosamine, which is you're looking for the hip, and everything else in there. The MSM is at a 250. You can find other stuff over the internet, but like I said, Petco, PetSmart, keep it simple, keep it stupid. This stuff works great. So yeah, that's what we do. You can get deals over the internet. Just make sure it's veterinarian and it's USD or US whatever medication approved. My wife does all that stuff. But anyways, those are things that I've been doing. This is Maggie again. Tplo knee surgery on the ACL with the plate put in. We ice her down. I use pea bags, like I said. I use 2 bags of peas, frozen. I've been using the same bags for a week now. I just put them on long ways after she gets done with her walks and stuff like that, and it seems to work out. Seems to keep the ice swelling down a lot. But anywho, these are things that we're doing. This is the German Shepherd. 6 weeks after a Tplo surgery. I just went over the things that we're doing to get her through her recovery, and hopefully soon we'll be in the pool and working in the water and stuff like that. But this is part 1 of the video. If you guys have any questions, feel free to ask. Sorry it's all choppy or whatnot, but I'm just trying to get the information out there. So like I said, there's the information. Hopefully this will help you out in your surgery or your problems with your animal. Have a great day, guys. Thanks for watching.